So we're excited to have you here. My name's Nadine Skinner. I am the Research Grants Manager for MDF, and I am very excited to introduce you all to Dr. Lott. He is going to be presenting to you today on exercise and DM. So this session is going to run for 45 minutes. And the way it's going to work, it's going to start with a presentation, and then we're going to have a question and answer session. So please do save your questions for the question and answer session, so that we can all have a chance to hear the presentation first. This session will be recorded, and you will have a chance to see the recordings afterwards as well. So if you miss anything, don't worry, we have the recordings for you. So with that, I'm very, very excited to turn things over to Dr. Lott, our expert here, who will be able to share with you a lot about exercise and myotonic dystrophy. Thank you.
Thank you, Nadine. And I'm really excited to have everybody here today. I think exercise is something that's a really important topic when we start talking about myotonic dystrophy, and excited to share a little bit about what's out there in the literature and what we have known, with a lot left to be known, as we'll talk a little bit about as well. So when we talk about exercise, what do you guys think of when you hear the word exercise? It can conjure up a lot of different thoughts. Some of you might think exercise, maybe something like this comes to mind, right? And somebody who's in the gym doing a lot of workouts, and it's like, boy, I could never look like that. Some people might say, I don't want to look like that. But we have one kind of thought process that may be going through our minds when we think of exercise, right? Others may be thinking, when they hear the word exercise, maybe thinking a little bit more of like, oh, I think about exercise, I'm just exhausted. I'm so tired. I can't do things that I want to do. And so it's important when we start thinking about exercise that we start to shape, well, what are our experiences that we've had with exercise? And how can we get in the right mindset when we start to think about exercise so that it can be something that we can benefit from and that we can enjoy? Because here we have a few other possibilities, what we might think of when we think of exercise. Something with regards to a sense of accomplishment, something with regards to working and allowing my body to move and having an improvement in physical health, something with regards to camaraderie, whether it's with one individual that we're with or in a group class, or sometimes it's being able to be by ourselves, or we're able to enjoy sometimes what we're able to do. So we have a lot of different ways of what we think of when we have with exercise. And I wanted to start off with that because it's important when we think of exercise and where we're at right now, how are we going to move forward with what we think about for exercise for ourselves? So with exercise, there's four main types of exercise we want to think about when we think of any kind of exercise, but especially also for individuals with myotonic dystrophy. We have down in the bottom left corner, flexibility or stretching component, which is really important so that we can maintain proper range of motion, movement. We have the cardiovascular or aerobic kind of exercise, again, thinking about what's going to happen with our breathing and our heart function as we're exercising, that generally is going to take a few minutes to dozens of minutes of what we're going to do to be able to get some impact with that kind of exercise. We have resistance or strengthening kinds of exercise, where we're looking at muscular fitness, portions of muscle power, muscle endurance, and muscle strength. And then we also have an important component with regards to balance in the lower right-hand corner. So thinking about how can we use sensory information coupled with strength, coupled with the ability to respond to ensure that we have a good balance and coordination that will facilitate other exercises, but more importantly, facilitate what we need to do with our day-to-day lives. So the American College of Sports Medicine, not specific to myotonic dystrophy, but to the general population, that says we need to think about exercise, how we think about medicine. We think of medicine. I go to my physician. My physician says, here are here's this medication. It is a dosage that you're prescribed. There's a time or frequency that you take it, and there's a duration with what you do. So we have all these specific parameters. If we can think of exercise in that form or fashion, we can start thinking about how can this be specific and individualized for us to be able to receive benefit. And this EIM, or Exercise is Medicine initiative, really is trying to be able to facilitate healthcare providers, physicians, as they work with their patients to remember physical activity and exercise are important components to talk to their patients about, so that they're able to have that incorporated just as they might with some kind of other pharmaceutical intervention, so that coupled together, you can maximize the benefit, the health of individuals. So from the American College of Sports Medicine, when we start thinking about the general population, we see, individuals performing the least physical activity benefit the most, even from modest increases in physical activity. Now, this is exceptional news, because if you're on the end of, I don't exercise, I don't like to exercise, is it worth to even get started? Just doing something, even a little bit, those individuals who are less active actually are going to get a lot of gains with just a small amount. Doesn't mean you should only do that small amount, but getting started and getting that momentum going is such a key aspect. So remembering this kind of information is really helpful and very important. The other is, when you start thinking about exercise, ideally doing both aerobic and strengthening or resistive kind of exercises combined will give you the most benefit, but even doing one in isolation will give you some benefit. So thinking about this from an aspect of move more and sit less. I know as we're sitting here listening to exercise, it's different, right? But being able to think about, well, what can I do to do more? Because some is better than none, all right? And we're all on different wavelengths of where we are in exercise. So I'm talking kind of from a general perspective of where you are and what can I do from here? Even if I'm not very active, it's not that you shouldn't get started. You can and you should, and there's some ways that will be able to be helpful for you. And we know benefits, right? This isn't new. If we were to take the benefits that you get from exercise and put it in a pill, it'd be $1 billion industry. It really would. There's no medication that is as powerful as exercise. And this is just a partial list of all these benefits. But you think about, it's going to make you live longer. It's going to reduce these big killers that we know about, cardiovascular disease, cancers, hypertension. These are the things that really are the big items we look out at what's happening to the general population. So big benefits that are there. But we also have to keep in mind with exercise, there's a balance, it's a scale, right? So when we start thinking about exercise, even in the general population, if somebody doesn't do any exercise and stays in bed and doesn't move a lot, those muscles are going to atrophy. But if somebody, not even with muscular dystrophy, somebody in the general population does a lot of exercise and pushes too far, there can be muscle injury, there can be other kinds of injury. So it's a balance of where you're going to be. And when we now start apply that a little bit more, thinking about myotonic dystrophy, we have to start thinking, well, where does this balance lie? Because how much is too much? How much is too little? And the good news is we'll see is there is some information on this. But the other piece that's important is when people were asked, there's almost 1,200 people with myotonic dystrophy asked a few years ago in the Christopher Clock. They were saying, what are the most prevalent symptoms? What are the most important things to you that you're having issues and challenges with? The top two from this paper, muscle weakness and fatigue. We think about what exercise can really do. This is a great need to be able to go ahead and address those top two symptoms that you can see. 90+% of individuals are reporting these are some important considerations that I would like to have improved. This is what's affecting me. So some important things when we think about that balance that's there. And as I said with myotonic dystrophy, we have what I call good news, and then I put not as good news. All right, I was thinking about that. It's really not bad news, because overall we have a lot of excellent information that's there. The good news, when we start thinking about, is there have been a lot of studies that have gone on for 20 plus years that have shown that if you're thinking about exercise, the old mantra was, if you have muscular dystrophy of any kind, don't exercise. It's going to make things worse. It's going to exacerbate. You're going to cause a lot of injury. So it's better not to push it off. We now know that exercise at a moderate intensity, in numerous studies that's been looked at, that it seems to be safe. Some studies have said, well, it's safe. It may not do a lot of improvement. Others have said, actually, it does show some improvement. And that has been going on for a couple of decades now. And even though exercise doesn't cure myotonic dystrophy, we do know that it will help to optimize function, helping you to do the things that you need to do in your regular daily tasks, as well as trying to be able to maintain muscle strength and mass. Also on this good news is we have a lot more information. As you start looking at the literature, there was an excellent review that was put out in 2019 where they said, here's a bunch of stuff we know about exercise. And it's pretty promising. Since that's been published in the last 5 years, and there's probably 7 or studies that I'll put up here that have done and looked at how can exercise impact people with myotonic dystrophy. And there have been very positive results, and none of them have had adverse events. And again, keeping in mind what they did is more of that moderate intensity. This is where things are for those studies. So a lot of good news. The not so good news, and again, this isn't really bad news, is ideally, we know a little bit about how to get individualization of exercise. We're getting an idea of some parameters. We're getting an idea of what's there, but we don't have it as much as we would for other populations. And one part of it is, as we look around the room and as you're in interaction with an event like this, nobody hears the same. Everybody's different. And so it's being able to get some understanding, well, what would be good overall, but we still need to find a little bit more about what would be best as we individualize exercise prescription for individuals so that they can do what's going to be best for them, which may be a little bit different from one person to the other. All right. So I have to stay tuned because that's what has continued to move along. And that's where things are headed further. 10 years from now, you will have, I'm sure, 10 times more information. What I present today, 10 years from now, they're going to look at it and go, well, that's what Donovan said back in 2024. But this is what we know now, which is so much more advanced. So it's an exciting time of where research is moving ahead. So I mentioned about these 4 components of exercise, and we're going to talk briefly about each of these, starting with flexibility and stretching. So when you think of flexibility and stretching, this again is really trying to be able to promote the ability to move in an appropriate fashion so that we can then do, whether it's other exercises, physical activity, or all the other things that we need to do. We do have some overall parameters for these that can be utilized and applied very well for people with myotonic dystrophy. How often should we do it? It says at least, and I make that a point because you're going to see some others where we talk about it says a specific number of days. It says at least because this is something that you should be doing 2 to 3 times a week, ideally. But if you do it more than that, that's okay. And as we're doing this kind of stretching flexibility, there is a proper amount. When I see patients, I say, if you don't feel anything, you're probably not doing anything that's going to benefit you. But if it's hurting, you're doing it too hard and you're probably causing harm. So as you're doing these kinds of stretches, where you need to go, you want to go to that point of where there's muscle tightness, maybe a slight discomfort, but you don't want to go beyond that. If you're going beyond that, again, you're probably causing more damage. And so staying within this realm, but if you don't feel anything, probably not doing anything beneficial, okay? And as you're doing these, you'll see there's different things that have been published, but the biggest item is really holding those stretches. So you have them, it's a static stretch is what I'm talking about here, holding it still for about 10 to 30 seconds at a time with a total time of about 60 seconds. So if you're going to hold it for 15 seconds, do 4 of them. If you're doing it for 30 seconds, hold for 2. So that total time, you're getting a good 60 seconds. Yeah. And the other that's really helpful is prior to going ahead and doing some flexibility stretching, try to get that muscle group warmed up. So if you're going to be stretching your arms, cycling with your legs probably is the best thing to do. So do something to get your arms warmed up, whether it's moving your arms, cycling, doing something there, but warming up that tissue to allow the blood to circulate will make it a little bit more effective. And when it comes to flexibility and stretching, different people have different physical abilities. It may be something that you're able to do on your own, where you can, similar to some of these, get on the floor, work on your hamstrings, stand up, work on your calves, these kinds of pieces that are out there. It may be that you need a little bit of assistance, or the person that you live with may need a little bit of assistance. So making sure that you're supporting other joints. If I'm stretching down and I want to work on the wrist, I want to make sure that the elbow is also supported as I am applying some resistance and trying to get some stretch in this area, as opposed to letting that flop, letting anything else that may actually cause a small injury to joints that are a little closer to the body. And then again, if the person who is being stretched but also it's important that they're able to understand and communicate. When is that point? If you're doing the stretching, you'll feel some muscle tightness. That's not the same as what they're perceiving and feeling. And this relates to the point of them feeling muscle tightness or that slight discomfort. So really making sure that that's communicated well as you're going ahead with a good stretching and flexibility program. For aerobic exercise, and again, as I mentioned earlier, this is really looking at trying to get heart rate going, trying to get your breathing working. And for the general population, they say the goal is 150 to 300 minutes per week at a moderate intensity. Now, for other individuals that aren't of the general population, which would include people with myotonic dystrophy, the goal is the same. It's not less. That said, if you look at that and think that is too daunting, there's no way I can get that, that's okay. That can be the goal of where we're getting to at some point in time. And for those of you who can do it, I'd encourage you to do so. But it might be, you know what, I don't do much of any, so I'm going to go ahead and I'm going to do 5 to 10 minutes a day, and I'm going to build up to that. And that's great. Again, going back to some is better than none, and even modest increases for people who are not reactive are going to get really good benefits. Okay. Some examples of aerobic exercise. We have a gentleman here cycling, walking briskly, an elliptical machine, getting in a pool, doing household tasks of vacuuming, dusting, all those kinds of things. And for those of you who want to say, well, my spouse does this, maybe it'd be a good chance for your spouse to say, well, this would be a good exercise for you to do too. As long as you can safely do so, that can be a very good way of getting more activity. And dancing, which they tend to have at some of these events, which can be a really good thing. And again, it depends on individuals' abilities. Some people can get on a bicycle like this and pedal away and be safe and great. Others may need more of a recumbent bicycle. Others may be in a wheelchair where it's a little device that could be on the floor that they can go ahead and cycle. Or it may be a little device to put on a table where there's some cycling with the arms that they can do. So there's a lot of different ways of making this adjustment. Walking briskly, I love to talk to patients about walking. Because if that's something that you can safely do, it doesn't require a lot of equipment. But if you can't walk, there's other things that you can do. If you're in your wheelchair, getting yourself moving around the wheelchair is another very good way of getting that kind of aerobic kind of capacity. Elliptical machines can be very helpful for individuals who need to hold on to something. And maybe it's something where that the ability to lift up the foot during walking is very difficult. Well, that now eliminates it because you're able to do that elliptical where it's stationary. So giving a little bit more stabilization. We're in Florida. Well, I'm from in Utah. I wouldn't talk as much about aquatic and pool kinds of exercise, but we've got a lot of pools, right? We've got a lot of sunshine. And so if you have the ability and opportunity to get in that pool, it doesn't mean swimming is the only exercise. Well, that's fantastic. But walking in the pool, moving in the pool, doing some activity, again, looking at your heart rate and breathing to get going. And how much should it get going? Well, if we think about looking at intensity, that's an important consideration. And again, the goal should be a moderate intensity. I have light to moderate because I'm going to talk about both of these with a couple ways that you can measure this without any equipment, and it's very easy to do. So one of them, if you're thinking looking at intensity, is a talk test. So this one, if you're thinking of light intensity, it means I'm doing an activity where I can talk and I can also sing. And that's a light intensity. When I go walking my dog at night with my wife, we do a light intensity work. When I'm not with my wife, and I'm with my dog who's almost 60 pounds and is pulling me along, it's more of a moderate intensity. I can talk, but my dogs are really appreciative that I can't sing. And so now it's more of a moderate intensity. So I can talk, but that's just something as I'm doing any kind of aerobic activity, I can test that very quickly and see where I'm at, right? There's another means, looking at a rating of perceived exertion. So this is, sometimes you might see this at a 6 to 20. I have a 0 to 10 scale. I think that's a little easier if you're not familiar with it. To think, well, where do I feel? So if I'm doing exercise, a light intensity would be less than 5. So maybe that 3 or 4. And again, if you can't do moderate and you're more comfortable in light, some is better than none. But ideally, you want to get up more to that 5 to 6 of a moderate intensity while we're doing this kind of aerobic activity. And that's going to be able to give us some benefit. And we have some research that goes along to help support that. 2005, remember I mentioned this, we've known this for 20 so years. So 2005, this group went ahead and they said, let's look at home-based cycling. So they got some individuals, some cycles. They had them go ahead 4 to 5 times a week for 12 weeks. They did a 5-minute warm-up, and then they had them pedal for 30 minutes. So, how long was this going on? How did this work? These individuals, all with myotonic dystrophy, showed improvements in their ability to use oxygen, their cardiovascular fitness level. They were able to do more work over time of that 12 weeks while still having their heart rate being lowered or improved. So there were some good benefits. And importantly to note, even 20 plus years ago, this kind of program didn't have any adverse events. Nobody had any problems. Nothing was exacerbated. This was great. More recently, another group did something very similar. It wasn't a home-based cycling, but they said, we're going to have them exercise. And you'll note, they only did this 3 times a week for 30 minutes. So this wasn't even at the 150-minute mark. This was even less. Again, shooting for the 150 is what we want, but this is even less. So with this kind of a program, they not only had improvements in cardiovascular fitness, muscular endurance, mobility, total lean mass meaning that they have less fat and more muscle. So these are all when we're thinking about what kind of benefits do you want? Some excellent benefits that are here. And again, no adverse events. Nobody had injuries or other things that were going on. So keeping at this kind of intensity prescription was a great thing to be able to do. Resistance and strengthening. We talked about 3 different components, strength, endurance, and power. So how much can you strength-wise push something up one time? Endurance, how many times can you do something with a load repetitively? And power has to do more with the time component, speed of it. What has been looked at in the literature is really looking more at what affects strength and endurance. So this moderate intensity of 8 to 12 repetitions. So that should be at this stage, you think, as I'm doing a set of exercise, by the time I get somewhere between 8 to 12, I can probably do maybe one, maybe two more. That's probably where I want to stop. That's more of that moderate intensity, okay? And thinking of major muscle groups, so thinking of chest, arms, back, thighs, lower legs. If we're thinking about what are the areas, that's what they kind of talk about with major muscle groups, okay? And examples. There are all kinds of different ways, right? We have free weights, we have weight machines, we have resisted bands, you can get in the pool and use body weight. These are pictures, but we can think about, well, what about individuals who have a little bit more challenging time? So if I have a hard time and I'm unable to hold on to something, well, that's where something like using these wrist cuff weights, like sandbags, allows somebody to have some resistance, but they don't have to worry about the gripping. And so that's a way to be able to still do some exercise. You see this gentleman making some adaptations with being able to just ensure things are lined up while he's still in his wheelchair. A same kind of element here where this individual, if for some reason the gripping to hold on a TheraBand or resisted band can't be done, to be able to put it around the forearms. So now the gripping is being able to be eliminated, but we can still get some resistance going on. And in the pool, we can use this for aerobic, but we can also use with these flotation kinds of bars that can be held, our resistance against the water, or similar to the sandbag weights, there's floaties that can be attached to the wrist, to the ankles, that allow now a resistance so that you're looking at that 8 to 12 repetitions. And body weight can be a very good way. Now, these are a little bit more advanced kinds of body weight exercises. But for those who can't do these kinds of exercise, being able to be in a position where they're just moving against gravity, whether it's with their arms, or if trying to be able to do some things where if it's supported, so that they can then go ahead and straighten and bend the elbows. It could be on a kitchen counter, where again, that support to be able to work and do some movements. So thinking about what can be done in different ways here. This group this is a Canadian group, and they said, we're going to go ahead and do some resistance exercise 2 times a week for 12 weeks. And we're going to have it for 3 sets of 16 repetitions. So this was actually a little bit more vigorous. This is on that vigorous to moderate, so a little bit even higher. And as they did things, they were focused on the lower extremities, the legs. So they did leg extension, kicking forward, leg press, hip abduction, swinging the leg to the side, the muscles that are key for the side of the hip, squatting, and then plantar flexion, the calf muscles. And as they did this exercise routine, they had improvements in strength and improvements in the mobility measures that were done, which was very good. And again, no adverse side effects were noted with what had been done with this program. This same group with a few other investigators, because part of this was they took a muscle biopsy, they went and they said, let's look at that. Oh, excuse me, we'll get to the muscle biopsy. But the same group went ahead and they looked at some scales of, well, how did this resistance exercise affect fatigue and daytime sleepiness and apathy? Or that I really don't care. I don't have enthusiasm. I'm not really something that I want to do. And found that resistance exercise impacted these characteristics as well. So from a neurobehavioral standpoint, also had an impact, which is awesome because I don't know about you, but exercise sometimes can be a little daunting. And it may be something I don't want to do. And if I already have more apathy, if I'm already fatigued, I'm going to be less likely to do so. But it actually improved these aspects as well. Not just when the 12 weeks ended, but 3 months and 6 months afterwards, they still had those improvements. And another group went in and said, for the biopsies that were taken out, they went and said, let's look at what's going on with what they call the powerhouse of the cell, the mitochondria, the cell that helps to really help get oxygen utilized for energy. And found that those mitochondria had increased in number and size, and they were more efficient in what they were doing, helping from a cellular level to be able to have different kinds of changes. And then Andy Berglund's group with Davey and Planco, they had another study where they said, let's also look at some tissue, but now let's look at what's going on from those alternate splicing. So really getting at the gene expression level. So it's kind of exciting. You know, exercise, we say they can walk farther and they get more strength. We should think that, but we start looking at all other kinds of items that are here, that we're getting some answers of what could be something that will be very powerful and a very understanding to be able to say, from a mechanistic standpoint, we're on the cusp. You can see these are very recent papers of how can we start thinking about how this is going to impact individuals from an individual level. In fact, this last paper on alternative splicing, when they looked at the group data, it was hard for them to see a whole lot. But when they started looking at it individualized and saying, how did the people who responded with greater strength gains, what happened to things on gene expression? And on an individual basis, that's where they were able to see the impact. And so how can we move this ahead is an important consideration. Now, all of this has been people with myotonic dystrophy type 1 as far as these studies. But the good news is There's a study that's been done on resistance exercise in people with myotonic dystrophy type 2 as well. And this program was a very good comprehensive program. They had a warm-up. So starting with 10 minutes of cycling, followed by some stretching. And then they had resistance exercise for 16 weeks, 2 times a week, 2 sets of 12 repetitions. And you can see, this is a good long list of exercises for the arms, the chest, the legs, going down to the core and with abdominals and the back. And then they had a cycling portion after a 10-minute rest of finishing the resistance, a cycling component looking at aerobics. So this was a combined kind of exercise routine. And this took close to 2 hours for people to do at a time. So this is, if you haven't done a lot of exercise, I don't want you to walk out and go, well, this is what I need to start with. But this is a good routine to start thinking about, are there components that I can start doing? Because with this exercise session, look at the list of what they saw for improvements. Again, no adverse events, but people were stronger with their hands and arms, stronger with regards to their legs and what they're able to do, better at getting around. They had improved lean body mass, stronger bones. They had better cardiovascular endurance. Their blood pressure, both at rest as well as after exercise, was improved. And they reported when they had a questionnaire, I feel better overall for my general health and my physical function. So this is a really great paper that's showing that this is good. This resistance exercise for what we've been able to see thus far. And again, we're thinking of what's been happening the last few years. So balance is another key aspect that we mentioned earlier. And often this is impaired, of course, in people with myotonic dystrophy. And if we look back to the Christopher Project paper and what people said, these are the most prevalent symptoms that are most important to me. Well, in the top 5, balance issues. It's still looking at over 80% if we look at all people with myotonic dystrophy, nearly 1,200 people who were surveyed. And it's been reported that people with myotonic dystrophy have a 10 times greater risk of falling or stumbling. And this can be related to various aspects. Cameron, when she had looked, she said, here's 3 items that really stand out. One of them has to do with ankle strength. And so again, as we talked earlier about that ability to pick up the ankle, the foot, during that swing phase of gait, bringing the foot forward, if that's not able to be done, that can lead to some falls or stumbles, as well as the ability to push off. That's another aspect. So that strength is important, which directly relates to walking speed. The strength to be able to push off is related to that walking speed. And then also confidence and balance. So looking at individuals and how comfortable is the individual with regards to what they feel they can maintain their balance on different kinds of conditions. So these are important aspects to keep in mind. And with balance and types of activities and training, this is really looking at trying to be able to strengthen all kinds of muscles, but particularly thinking about what's going on with the muscles that help you stay upright, of the legs, of the torso, of the pelvis. These are really some core pieces. And it's looking at exercise that not only are strengthening, but coupled with the sensory system of looking to see how can everything integrate together. Because it's not just, I can able to lift something, but it's being able to make those adjustments, right? And as you can see with this gentleman up here, this can be various ways of going ahead and doing kinds of exercises, using firm surfaces and soft surfaces to be able to change with that. Just if from a standing still standpoint, if I can stand still and I can stand still, bring my feet together, well, can I do that same on an unstable surface? If that's easy, how about if I stand in tandem, heel to toe? If that's easy, what about if I can stand on one leg? Changing those surfaces, challenging yourself. Eyes closed makes it a little bit more, because now, again, we're getting to other sensations, or sensory systems that we have to use specific to the joints. So how can we go ahead and incorporate these kinds of things? And if you're unable to stand, you can still do these type of things in sitting. Getting sitting balance can be a very important consideration for individuals that can help work on core strength as well. All right? And the other piece with that is this is something that, while all things should be individualized, as I've mentioned, for balance training, this is something that while you can try a few things, and if you do, make sure that you have a camera or something close by so that you're able to do things safely, but getting things from an individual basis, and ideally having a consultation with someone such as a physical therapist or somebody who can do a balance evaluation to give you a more individualized type of balance training program. And this has been done where this program focused on balance, but it had some other components as well. So it was a rehab program that was 2 to 3 times a week for 6 weeks, where they had a total of 15 sessions. And it had not just balance, but a little bit of some flexibility, stretching, some strengthening, and even some endurance or aerobic kinds of components. And as they went ahead and did this program, these items over here, this is our Berg balance scale, which is a scale that looks at standing balance still kinds of things, moving standing, sitting kinds of balance. So it's looking at a comprehensive kind of assessment. This functional reach, this FRT, is what's shown up here, where how far can you reach forward without taking a step. And a lot of work has been demonstrated to say that as I can take my center of mass farther from my base of support, I have a greater balance ability. And then also the tug, or the timed up and go, standing from a chair, walking 3 meters, turning around, coming back and sitting down. How quickly can you do that? Looking at different components of that. And all of those improved with this kind of program. There was also improvements in strength. They were looking primarily at the thigh because that's where they did the strength. But improvements in strength, which again, thinking back about the strength is an aspect to keep in mind for balance. And then also walking speed. So some of those key components we're able to get from improvements. So again, no adverse events, but able to see some good improvements. Now, and one important piece, because all of this is like, Donovan, this is great information. This should be on the 10 o'clock news all the time, right? And it is exciting. One aspect, and this is the item to keep in mind, these studies, this study had 20 people in it, which is pretty good for a rare disease doing exercise. The other studies, we're looking at about 9 to 12. So that's not bad news, but it tells us that, yes, this is good information, but we need to have more. So again, it's building to what we need. But the last 5 years, we've had some really good information where we start saying, there are some parameters we can start to think about, and how can we go ahead and optimize this even further. But one thing to keep in mind, the no pain, no gain. I know when I was in high school, I used to hear that from a lot of people, especially coaches and things. That's not something that you should have in mind. Hence the big red X, okay? If you're having some pains with what you're doing exercise-wise, you're doing too much, all right? And so your safety and that balance is an important consideration with where you're at. And so there are some exercise guidelines I'm gonna mention. And these are some items I would encourage you to keep in mind. And again, 10 years from now, these may be a little different. And I'm talking about the general population as a whole for myotonic dystrophy. You may be a little different than someone else. These may be a little different, but keeping this in mind to make sure that you're safe as you're moving ahead, especially if you're starting off with what you're going to be doing for an exercise program. So one is, you shouldn't go to exhaustion. If you're done with your exercise program, you're like, I'm having a hard time just walking out to my car. Or the next day, I'm so exhausted, I'm having a hard time getting out of bed. You overdid it. So that should be something to think about and go, you know what, next time I'm going to do something. First, I'm going to take at least a couple days rest, and I'm going to do a little less. That's okay. We're trying to find, again, it's finding that balance of where you're at, and you're going to respond a little differently. But getting that ball moving is the important aspect too. The other is, while you're doing exercise, you shouldn't be getting a lot of pain. Again, that no pain, no gain. And there is muscles you've heard, tear down to build up. So there is this little bit of this micro trauma with regards to things. And there can be this delayed onset muscle soreness. If I'm working with an individual who does not have muscular dystrophy, I'm going to push them a little harder. I'm not going to be as concerned with that delayed onset muscle soreness. With what the information we have as of today, if I have somebody with myotonic dystrophy, I would want them to have no more than a mild muscle soreness. And really, I don't want that to last anywhere 24, 36 hours. So if you're that next day, you're like, I'm pretty sore. Well, that's not the end of the world, but it means you probably need to back off a little bit. Okay, so this is a way to kind of gauge where you're at. Also, make sure you're taking rest breaks. So I mentioned when the people did the resistance exercise, they made sure to take at least a 10-minute rest before they started an aerobic. If you're doing resistance exercise, give yourself 2 to 3 minutes of rest between sets and between exercises. Allow your body to recover so that it can do well for each portion you're doing. And stay hydrated, especially if you're in a hot, humid environment. All right, but make sure that you're keeping your body full of fluids, which will keep you healthy during and after exercise. And again, that mantra, it's not that you have to do it all. If you haven't been exercising, I think all that we've talked about is helpful, but it doesn't mean this is where you should start. It means to think about what can you do to start implementing this in your life. To start low and go slow is okay, but just get that ball moving. The other is, that's very important, is you start thinking about, well, how can I work with my healthcare team? If you're starting a new exercise program, make sure that you're talking to your physician. Your physician will be able to have some insights about you as an individual. And this is important. We talk about muscle, right? Whether it has to do with aerobic and everything else, but it's also impacting your heart. Even the resistance exercise is impacting your heart. Your heart's muscle, it's cardiac tissue, it's cardiac muscle. And you want to be able to work it in a safe way, but we do know with myotonic dystrophy that it also impacts the heart. Doesn't mean that you can't exercise, but it does mean it's very important to speak with your physician so that they can work with you in getting a proper exercise started and a good understanding of what can be progressed and done. Also, I mentioned about balance, but for all other kinds of aspects, you can consider talking to a physical therapist. I'm biased here, I'll admit, but having somebody who has a knowledge of myotonic dystrophy. It could be another professional who has a lot of experience with exercise and has an understanding of myotonic dystrophy. But that's an important aspect as well. In the literature, well, not so much in the literature, online, in vlogs, in blogs, in podcasts, you may see on YouTube, I have muscular dystrophy and this is the best thing that I can do. Well, that doesn't mean that it's the best thing for you. Muscular dystrophies are not the same. I gave a talk in December with a different group for muscular dystrophy. There's some pieces that were similar, but there's other things that are different that I tell you that I wouldn't tell them and vice versa. So keeping that in mind. The other is, you're not the same as everybody else in here, right? So keeping in mind that not only are not all muscular dystrophies the same, but you are not the same. So it's good to hear and learn, but then again, going back to your healthcare team is an important consideration as you're going to move ahead and progress. The other is really do something that you enjoy. If you don't enjoy it, you're not going to want to do it. If it's a drudgery, well, then you need to find something else, okay? And that's an important component. Find ways that you're not like beating yourself up, oh my goodness, I only did 2 exercises 2 days last week, and I know I need to do more than that. Donovan talked about that, and it's more important. No, reward yourself. I did 2 days of exercise. That means that I'm going to watch my favorite show on Netflix for another half hour. I'm going to go ahead and I'm going to have that cookie. And I'm not trying to say ruin your diet, be inactive. I'm trying to say find things you say, this is a reward. It will help you so that long-term compliance and that this is something I want to do will continue. And again, this is similar to the slide I had to start off. I just changed the wording. Not what do you think when you hear the word exercise, but what do you want to feel when you hear the word exercise? So if you're using this way, or again, whether it's with friends, whether it's by yourself, whether it's in classes, but finding something you enjoy, find a way to reward yourself, find a way to track that. That can be so helpful for yourself. A lot of what I've talked about comes from this guide. This link. This is from the Myotonic Dystrophy Foundation with these 2 wonderful and great physical therapists at Stanford, Tina Duong, and Kate Ike at University of Rochester. So this is available. It's for free. You have that you can download. Also, on that same, it's not the exact same link, but very similar to the Myotonic Dystrophy Foundation has a link with a document by these same 2 great experts that says, what should physical therapists know about myotonic dystrophy when working with patients? So if you think, well, I have a physical therapist, but I don't know how much they know about physical therapy, that link, you can share that with them. And it's not a huge detail, but it gives them a good overview of myotonic dystrophy and important considerations when they're working with a patient with myotonic dystrophy, which is important for you. I know as a physical therapist, 15 years ago, I wasn't working with people with muscular dystrophy. And so I did a lot of work with other people. And if I would have had somebody come into a clinic, I would have thought, well, I need to, look at things a little differently, but I'm going to probably do things very similar. And there are some key differences that need to be noted so that you are taken care of well. So share this information. If they don't know, they can go ahead and find that through there, and they can reach out to other people. I know Tina, Kate, myself, and others who are physical therapists. We're more than willing to have a physical therapist contact and say, okay, I'm working with a patient. Do you have any other insights? So there is that community. That's what's so good about having this kind of a get together, is so that we can share and learn and have that the ability to network. So please make sure that you have a note of that. And I really appreciate you being here and would love to hear any thoughts that you have. It's not just questions, but I know some of you are like, hey, this is what I've done. It's a good discussion too. So thank you very much.
About what you said about being in Florida with the weather, and that's leading into the whole forest bathing, being outdoors, the trees, and just nature. What are your thoughts on being able to get out in nature to exercise, or even in the virtual world, surrounded by nature, versus I'm in a gym, just the cold hard machines, or at the pool with just the water, my weights? What are your thoughts on getting out if one can versus being indoors?
You bet. Did you hear that in the back? Okay, great. Wanted to make sure. So excellent point. And I mentioned I did a talk in December with another group of muscular dystrophy. It was myself and a colleague of mine. And one of the items that she emphasized is how important it is to get outside and see the sun. The sun impacts us. I know years ago, 4 years ago, I had COVID and I had a hard time getting over it. And I was depressed. And I had somebody who said, you need to get outside and walk. So I had a field by my house. So I wasn't around anybody. I would go out, and that made, for me personally, such a huge difference. Now, does that mean that's for everyone? No, it's not. Some people, the gym, that's my happy place. And if so, and that's where I think that's fantastic. But definitely getting outside, one, the sun can do wonders. Two, we have a beautiful state, as you mentioned. And three, you want to do something you enjoy. So find what it is that fits for you. So there's not a hard, fast rule, but if that's something that you like to do, awesome to do. The only thing I would come back to is make sure that you're hydrated, because it gets hot and humid, not so much in March as in July, right? And the other is, as you're going along, if you're going out walking, make sure that you're prepared in a safe manner. So if you have a more difficult time walking, you probably aren't going to want to go on a path with a lot of roots and dirt, but find something with a pathway that'll be safe. Knowing that there are certain areas, it might be a 10-mile walk that you say, well, I'm only going to walk X amount of distance because I know I can walk that distance and back safely. So just planning to help. Good, very good. Thank you. Other comments, questions? Yeah.
On the year one slide, they talk about
the alternative splicing? Sure. So with myotonic dystrophy, one of the items that happens is as genes are made is there's different kinds of splicing events that then have downstream effects. With myotonic dystrophy, there's some alterations that occur, and there's many of them occur. There's 22 that have been looked at, I'm going to say extensively, and that's a little bit of a reach, but very closely. But it's trying to better understand how those proteins then have the downstream effects. And so what they found is in this resistance exercise program, when they looked at individuals and looked to see, well, the people who had the most benefit from the strength and actually showed the most improvements in strength had the greatest improvements in having this alternate splicing, this dysregulation, actually was improved. Now, how does that impact everything downstream? We know it does. They didn't look far enough down with this time frame to see. But that's where it's an exciting, because it's looking at a mechanistic kind of standpoint. Because a lot of times with exercise studies, people say, well, that's well and good. People are walking better, they're stronger. But what's that doing from a disease process? This kind of information is saying it's impacting individuals. It's not just that they're feeling better and doing things, but it's impacting what could be something that will be the same kind of impact that some pharmaceutical companies are looking at, trying to improve alternative splicing dysregulation. It's something that, as you talk to some pharmaceutical companies, that's what you want to be done. So that's where, again, it doesn't mean that this is curative, but it's having a beneficial impact on that. Coupled with, ideally, pharmaceutical trials in the future, that can, and again, I'm an exercise guy, but really that is an optimal way of kind of looking ahead of what can be. Did that answer your question okay, Kristen? Yeah. Great. Yes, sir.
Water because muscle muscle, the muscle bottom. I will see what's done with the dog. Those years muscle making model. They make muscle. Riskful walk with them. The boss it. That was really sad. But you're not recommending breaking down muscle that they minus well. If that pulling muscle is breaking down, you'll go back and get there and stronger, more muscle.
So I think I heard 3 questions in there. No, it's okay. I just want to make sure that I heard you correctly. I was not criticizing. So one, and let me say I am not a dietitian or nutritionist. So when it comes to high protein kinds of aspects, I would not think that at this stage, high protein, I've not seen something that's going to be something that's really key. Because I pulled back to somebody I had as an instructor years ago who said, for those of you who are doing a lot of workouts, really the high protein's not needed unless you're working up from a higher athletic kind of population. Eat an extra tuna fish sandwich. That's probably going to give you the most protein you need, because a lot of it goes and expelled through urine. Now, if you're doing a very highly competitive kind of workout, which again is not what we've talked about here, that is a high protein can. So there's nothing that I have seen that a high protein content is something that would be important from a myotonic dystrophy standpoint, nor from these kinds of workouts. Does it mean that it's bad if you're taking some? No. but you may be actually urinating out a lot of that that's not needed, which can impact on kidneys, could be something else. We'll get to the micro, the other, what was the second part? The Russell Maze War. So as was noted on here, when we look at, there's nothing when it talks about weight as far as benefits, but what was pointed out, and this is an important point that I'm glad you asked. Whoops. Actually, it's the rubber grab ball. Right back. So it's total lean mass is what we're looking at. So you're correct that muscle can weigh more, but it doesn't have to, they lost weight. They had more lean mass, so they had more muscle relative to fat. And that is an important consideration we should do. And that's why we don't always look and say from a health aspect, we don't always look at, well, what's your weight? Body mass index can be used, which is a height to weight kind of ratio, which has general impacts looking at the population. But if you want to look at a really more specific, lean mass is a very good way when we start thinking about things. So that kind of goes along with that. As far as from the micro trauma, as we're doing works, that's work of any kind from a resistance standpoint, that's what muscle does, is there's a micro trauma that occurs to there. So am I saying that you do that or not? With what we have in here, with this kind of resistance exercise, I would suspect, and I have not seen reports they look at it, that there is that little bit of micro trauma. And when I talk about that micro trauma, we're not talking about muscle tears. We're talking about where the sarcomeres and lined up where they've got these little filaments are having this little bit of trauma that's in there with things. So what I do know is that these exercise programs, based on what we have here, have been shown to be effective and did not have any adverse effects. So that's the good news. What was the extent that's going on? They did not measure that, and I don't have a good answer for that. Is that okay? All right. Like creatine kinase? Uh-huh.
Like when I was running college, I was doing one.
Ideally, you do not want your CK levels to rise with activity. With muscular, it's already elevated. And creatine kinase in people without muscular dystrophy, that's one thing they'll look at and say, this, if you ever read about this person who's in a football practice and they have a lot of muscle damage, creatine kinase levels will increase, not to the extent of what you just said, but they've increased from a dozen to maybe 150, 200. So if your creatine kinase levels are increasing from the excess, that would be another thing of saying this is too much. But there would be other means. This, again, we didn't point out things like, well, make sure to draw your blood and get it red. But what can you do to monitor yourself by following these other kinds of aspects with regards to the pain, the watching for excessive fatigue, those kinds of aspects? That should allow you to avoid having any of those other kinds of issues. And again, in some of these studies, they did look at CK levels. Again, if those would have been elevated, that would have been considered an adverse event. So they're not finding that with these kinds of paradigms that they've done. I think, I think this gentleman had his hand.
I'm trying to make it clear.
Sure.
That's the EA, the boss, the down, terrible, or the penalty, about 25, there, they may be, but that that's the law. Anything that is justified, they can fight the down, make the issue, but yeah, it depends if the therapy. They can do this, they must get done with that. How are you good? What do you think that start? So what?
So
Where would he start?
I would start with what is it that he would be willing to do first and foremost.
A van.
I would say, what do you have? What are you willing to do? I think it's going to be important to talk to him to say, this is something that's important, and is it important to you? If so, why is it important? If not, why is it not important? But really having a good discussion and dialogue. You mentioned he's 38, so he has the ability to go ahead and give some input on things, but it's going to be important that you're able to talk to him about that. That's going to be the first, because coming back to what do you enjoy? What is he willing to do? And that start low and go slow is going to be really important. Lazy is not a term that I would use for that, but unmotivated. And it comes back to that athlete. And if he can see that this is something I can do and I can have some success, ideally and generally, that will lead to more success, more compliance, more enjoyment for what's going on. So I would have that discussion with him first and foremost to find out, is this important? And again, if so, why or why not? Talking about some of these aspects. What he already has access to is wonderful. That's, and there was a lot of things here because these kinds of machines aren't. But whether it's using those resistive bands, whether it has to do with some of those other items that I mentioned, just with body weight of moving. I had an individual, a colleague of mine, not related to my muscular dystrophy, but her expertise was with people who were between 500 or 400 and 800, 900 pounds. So these are individuals who hadn't moved a lot. She would start with things where they're sitting and just even moving the head, moving the arms, just doing little movements several times a day. And these are people who still were quite large when I remember seeing them, but they'd lost 200, 300 plus pounds, which was amazing. So what is it that he's willing to do? And again, that start low, go slow is something that from that aspect is going to be really important. But what will he do? Discussion about importance and looking to see, is it something that, because I know people who say, if I had this little cycle, that'd be great. You can get something that can go on the floor or the floor for the legs or on a desktop here. And it's something that on Amazon usually is $30 to $50 kind of a thing. There's used ones that you may be able to find on eBay or other pieces as well, or used sporting goods stores. So I would start with some things like that to see what is it that he can and is willing to do, and where is he at as far as his understanding of why this is important. I would have him get to do what he can do, where it's in, again, that 5 to 6. So once he gets to that point where he's like, all right, this is a pace that I'm feeling like I'm at that, I can talk, I can talk, but I can't sing. That'd be a good amount. How long? And again, this is where it'd be important that before you were to get that and get going, you can talk to your son right away, but I'd have him talk to his physician as well, because have there been any changes in the heart that's starting slow, and the slow progression is going to be important. So don't neglect that step either, especially if he hasn't been active for some period of time. Yeah. And those are important considerations. Again, that's his healthcare team can give it kind of a base. So I think having the discussion with him on starting is a good thing to you can get going on. Before getting him going with too much, I would have that conversation with the physician and the healthcare team. You bet.
All right, so if we can all thank Dr. Lott for taking some time.